A very good day to my dear lecturer and my fellow friends. I'm Heeswari Logamoorthy. I'm here today to present my title on sideroblastic anemia. What is so interesting about anemia? Before we start, I would like to share on the epidemiology statistic found in United States population. Do you know that sideroblastic anemia is considered a rare disease? By definition, rare disease affects fewer than 200,000 people in the United States population. Due to the low incidence and prevalence, researchers do not have defined statistical data on the epidemiology of this disorder. Well, let's move on to the introduction. Basically, sideroblastic anemia. Sidero means iron, which is Fe2+. Blastic defined as immature, and anemia is a condition where there's no number of healthy red blood cells in the body decreases. Although there are a normal to high amount of iron, but the body unable to utilize the iron to produce the RBCs during erythropoiesis. This results in ring formation surrounded nucleus rim contains non-heme iron. The size of RBCs of this anemia depends on the mutation, either microcytic or macrocytic. Well, to add on introduction, I would like to share some of the facts. Sideroblastic anemia is a rare blood disorder, as I said, that affects our body in the production of red blood cells. If you have sideroblastic anemia, you are anemic from lack of RBCs and too much of iron in your system. It totally opposite from IDA anemia, which is iron deficiency, meaning that the iron is very low, but in this case the iron is too much in your body, where your body can't utilize the iron to make the heme. Well, for people can bond with this condition with healthcare providers called congenital sideroblastic anemia or CSA. But more frequently, people develop or acquire sideroblastic anemia because they have a related blood disorder, take certain medication, or had too much exposure to certain minerals like zinc or copper. Infants and young children born with sideroblastic anemia may have life-threatening medical issues stemming from iron overloaded, and also adults who develop sideroblastic anemia may develop heart disease or cirrhosis, the liver disease. Providers can't cure congenital sideroblastic anemia because it is genetically linked, but they can manage the symptoms and prevent serious medical complications with medications. Providers also can cure some form of acquired sideroblastic anemia. Well, moving to the next part. On our slide here, we can see the biochemistry molecule structure of hemoglobin. The hemoglobin, basically a molecule, contains an important protein called heme. Structurally, the heme contains four proyl rings joined by four methyls bridged at the alpha position with an iron atom at the center of the ring. As a result of this protein molecule, the hemoglobin can perform its function of carrying oxygen to tissues. This is a normal structure of hemoglobin. How about our sideroblastic anemia? What will be the defect? Come, let's look on it. So now moving on the pathogenesis. It is understood that sideroblastic anemia is the result of defect in the steps of heme biosynthesis that occur within the mitochondrion. Sideroblastic anemia are the pathognomically featured sideroblastic anemia. There is a defect in incorporation of iron into the heme. That's why when we have this sideroblastic anemia, our body will be overloaded with iron which cannot synthesize into heme. As a result of the iron accumulation in mitochondria of red blood cells or red cell precursors, ring sideroblasts are erythroblasts that have iron-loaded mitochondria is produced. The iron granules are arranged around the nucleus in the ring form. They can be seen with Prussian blue staining as the blue granules around the nucleus is accumulated, where we can see that the iron is accumulated in blue color, whereby mechanism in the pathogenesis of sideroblastic anemia can be seen in our slide here, where we can say that as the normal production of heme, we need the ALA acid. As follows, it become propofologen and hydromethylbiline and urinofriogen 3, and followed by coprofriogen 3, and also last but not least to protofropinogen 9. So in this case, our protofropinogen 9 is absent or defect, whereby it impacts the production of heme. This is why our iron is not utilized in this case. Well, moving to the next part. This is the total pathogenesis of biochemistry flow of our sideroblastic anemia, but this here showing the normal hemoglobin heme production, where as I said, the defect will be at the protofrophin 9, where it caused by the accumulation of lead poisoning or alcohol abuse. We can see that on our sign and symptom, which is the causative agent. So now let's move on the sign and symptom. For this sideroblastic anemia, the patient or the person have this anemia, they might have these sign and symptoms, which their skin is pale or bronze colored because of the accumulation of too much of iron. Iron is basically brown color, so their skin turn to bronze color or pale color, and also their oxygen level is low due to their anemia. Then enlarged spleen or liver, which causes the liver function into a very bad condition, and also the spleen has been enlarged, which leads to a bad immune system, and also their heart population is very high or increased. Unhealthy kidney or kidney failure due to over accumulation of iron loaded in their body. The kidney try to process the iron out of the body and getting very tired, and also already unhealthy kidney, and also feeling dizzy because of, as I said, low oxygen due to anemia. Then let's move on to the lab diagnosis. Here I have noted that CBC, which is complete blood count, is needed in our hematology lab as for all disease, and then peripheral blood smear to see the iron accumulation, and then iron studies to confirm that the higher amount of iron is accumulated with iron studies, and also the ferritin level, and also with the serum iron to actually confirm that we are having seroblastic anemia, and also bone marrow aspiration, as well as to see the accumulation of the iron. So here what we will get from the lab diagnosis, we can see microcytic hypochromic anemia, where the cell size is small and the color is thicker, and normal to low reticulocyte count because it's immature red blood cells, since the heme is not produced. Increase in ferritin levels due to overloaded ions, decrease in total iron binding capacity as well as overloaded iron. Hematocrotic level will be 20% to 30%, high serum iron, a high transferrin saturation, basophilic stippling of red blood cell due to the mitochondrial defect, and ribosomal absence on peripheral blood smear in lead poisoning. Also with the fluorescent blue staining. This blue staining is very important to see our ring sideroblasts production, and also the appearance to confirm that we are having sideroblastic anemia. Then thrombotophenia and also leukopenia. So now let's moving on to the microscopic, how we will get on the blue color staining. As I said earlier, we can see the visible iron accumulation or the ring form of sideroblastic anemia. For the treatment, how about the treatment? The treatment is given according to the type of sideroblastic anemia. The X-linked sideroblastic anemia usually get for the males, because only males have one X chromosome compared to females. So, well, it is congenital, where I said they get from genetical or from the birth. Healthcare providers may give the vitamin B6 and reduce the amount of iron in their bloodstream. So, it is genetically, we can't do anything. We can just with giving some precautions. Then autosomal receivers congenital sideroblastic anemia, as well as genetical disorder caused the sideroblastic anemia. They will get blood transfusion and allogenic stem cell transplantation. Then followed by heavy metal exposure, medications, too much of zinc or too much of copper, vitamins is taken in the body, and myelodysplasia syndrome. So now let's move on to the prevention. To prevent sideroblastic anemia, we need to avoid accidental lead or arsenic poisoning. As I said, too much of too much of lead can cause our ribosomal absence and also denature some of the enzyme which are important in heme production, which is our delta aminovilunate dehydratase and ferrochelatase, which is very important in production, attaching the iron and red blood cell to produce the hemoglobin. And also, as I said, denatures of ribosome which cause the basophilic stippling in affecting in hematopoiesis. For limit alcohol intake, why we need to limit the alcohol intake? Excessive alcohol leads to mitochondrial damage as well. Mitochondria is very important in production of our heme, where it works with the cytosol. So vitamin 6 deficiency leads to mitochondria's ability to form heme. So their zinc supplement should be cope with common colds. Ask your health providers about the appropriate dosage over here, meaning that they need to seek for a proper advice from the medical advisors, because when they have some disease or some sick, they need the zinc supplement. They shouldn't take overdose, which can lead on the sideroblastic anemia, as well as they need to take some vitamin C in order to improvise their anemia level. So now let's move on a clinical case presentation. So here we can see a 52 years old African woman with a history of allergic retinitis and alcohol abuse. We can see she's a alcohol abuse presented with pre-synocope and the hemoglobin levels as the MCV, white blood cells, and negative for hemolysis or bleeding. So it's very important here is the zinc level was elevated at 186 microgram deciliter, which is more than the normal range. So this case presentation, we can conclude that this woman is having sideroblastic anemia caused by the copper deficiency induced by the zinc lozenges used by a significant component of severe anemia. So her zinc level in her body is too much, as well as she is an alcohol abuser. So it already leads to her copper deficiency, which is very important in production of our hemoglobin heme, which helps in the attachment of iron and the RBC to produce the heme. So she is not defect with B12 as well, and the folate levels are normal. She is only defect with the zinc lozenges that she have took for her chronic cough previously for last 4 months. Thank you so much. And this would be her clinical microscopic examination of the patient, where at the figure B we can see the blue color, the Prussian blue staining used, where we can see the accumulation of the iron in her RBCs. And also in A, we can see the figure A shows the abnormal RBCs, reticulocyte. The normal shape of RBCs is very, very low, which we can obviously say it is anemia. And B, we can state that sideroblastic anemia. Thank you.